Hello, I'm Dr. Paul Fisher with Innovative Nerve and Joint Centers, and today we're tackling a critical topic, the 10 signs you need to seek care for neuropathy now. We recently did a video on the 10 early warning signs of neuropathy that got a lot of interest, so I want to do one specifically for people who can't wait any longer. If you have neuropathy, please download my guide, 5 Things to Do to Help Your Neuropathy, by clicking on the link below. We see countless patients in our clinic struggling with neuropathy, and no one has said they wish they would have waited longer to get help. Recognizing these urgent signs can prevent serious complications and improve your quality of life. If you've noticed severe tingling, debilitating pain, or changes that disrupt your daily routine, these could be red flags that demand immediate attention. Over the next 10 to 15 minutes, we'll walk you through these signs, explain why they're serious, and share practical steps to take right away. Stay with us. This could be vital for you or someone you care about. This is not to be considered medical advice. If you are concerned that you may have neuropathy or any of the symptoms discussed today, please consult a healthcare professional. Okay, let's get started. Before we dive into the signs, let's clarify why acting quickly on neuropathy matters. Peripheral neuropathy happens when the nerves outside of your brain and spinal cord, your peripheral nervous system, get damaged or stop working properly. These nerves are like your body's wiring, carrying signals for sensation, movement, and automatic functions like digestion or heart rate. When they're compromised, it's like a short circuit, causing symptoms that can escalate fast. Common causes include diabetes, the leading trigger, as well as vitamin deficiencies like B12, infections, autoimmune condition, or injuries from repetitive stress. Certain medications, like those used in chemotherapy, can also play a role. Problem? These urgent signs we're covering today aren't just annoyances. They can signal rapid nerve damage that, if ignored, leads to chronic pain, disability, or even life-threatening complications, especially in diabetic patients. To be upfront, not every case of neuropathy follows a textbook, but these signs are critical warnings. By acting now, you're taking charge of your health. The first sign you need to seek care now is severe or rapidly worsening tingling in your hands or feet. You might feel an intense pins and needles sensation, like an electric shock, that doesn't ease up after adjusting your position or resting. This is called paresthesia. And when it's constant or spreading, say from your toes to your whole foot or from your fingers to your arms, it's a major red flag. We've had patients describe it as a buzzing they can't ignore, disrupting work or sleep. This happens because damaged nerves are firing chaotic signals to your brain, and severe cases suggest advanced damage. Start a symptom journal to note when it started, how intense it is, and if it's worse at night, which can point to circulation issues. Tight shoes or poor posture can make it worse, so check your footwear, but don't stop there. If tingling is relentless or spreading, call your doctor immediately. Tests like nerve conduction studies can reveal the extent of the damage and point to causes like diabetes or nerve compression. Sign number 2 is numbness in your hands, feet, or other areas. If you can't feel touch, hot or cold, or even minor injuries like stepping on a pebble without noticing, this is an emergency. Numbness means sensory nerves are barely functioning, like a phone with a dead screen that won't respond. We've seen patients come to our clinic with cuts or blisters they didn't feel, and one case was so severe we sent them straight to urgent care to prevent further infection. This is especially dangerous for diabetic patients, as unnoticed wounds can lead to ulcers or worse. Inspect your skin daily for cuts, redness, or swelling, and use a mirror for hard-to-see spots. Avoid extreme temperatures like hot showers until you are evaluated. Complete numbness demands immediately care to prevent complications and investigate causes like uncontrolled diabetes or vitamin deficiency. Sign number 3 is intense, unrelenting, burning pain in your feet or hands. This might feel like your skin is on fire or you're walking on hot coals, even when you're comfortably seated. Unlike occasional discomfort, this pain is constant or worsens at night, often keeping you awake. We posted a video recently explaining why this is worse at night. Essentially, reduced blood flow starves nerves of oxygen, causing them to misfire. Link below if you're interested. This hypersensitive nerve pain, like an alarm stuck on high, signals rapid neuropathy progression. We've had patients who couldn't tolerate socks or bed sheets because of this. Try cool, not cold, foot soaks, or loose clothing for temporary relief. But this is a sign to see your doctor now. A neurologist can explore treatments like medications or nerve therapies and test for causes like diabetic neuropathy or alcohol-related damage. Know when the pain is worse to help guide your care. Sign number 4 is sudden or severe muscle weakness that impacts daily tasks. If you're dropping objects like your phone, struggling to open jars, or finding your legs too weak to climb stairs, your motor nerves are likely in trouble. This is like a lagging internet signal between your brain and muscles, and it's urgent when it starts suddenly or worsens quickly. We've seen patients who thought it was just aging, only to find significant nerve damage. When paired with numbness, picking up small items like coins or buttons becomes nearly impossible. Gentle exercises under medical guidance might help, but don't delay. Sudden weakness could point to serious conditions like Guillain-Barré syndrome or advanced diabetic neuropathy. Contact a doctor for tests like electromyography to assess nerve and muscle function and start treatment to prevent further loss. Sign number 5 is falls or severe balance problems. If you're tripping off and wobbling on flat ground or grabbing furniture to steady yourself, neuropathy may be disrupting your proprioception, your body's sense of where it is in space. This is like a faulty Jeep's making walking unsteady. Falls are the biggest risk with neuropathy, not just amputations, as they can cause fractures or head injuries. We've noticed patients often first struggle in the shower, especially when closing their eyes, as visual cues mask the issue. Clear your home of hazards like loose rugs and use grip pads in the bathroom, but these won't fix the root problem. If balance issues are frequent, see a doctor immediately for nerve function tests and to explore causes like diabetes or B12 deficiency. Balance exercises may help, but only if guided by a professional. Sign number 6 is extreme sensitivity to touch or allodynia, where light contact feels intensely painful. Patients have told us they can't sleep with a sheet over their feet because it feels like a burn. This ties to reduced blood flow at night, amplifying nerve sensitivity, like a radio signal turned up too loud. Normal stimuli like clothing or a handshake become excruciating when nerves misfire. This can disrupt sleep or daily activities, and we've seen it devastate patients' quality of life. Loose, soft fabrics can help temporarily, but allodynia often signals advanced neuropathy. See a neurologist right away for treatments like topical creams or nerve blocks, and track what triggers the pain. Tests can identify the causes like chemotherapy, effects, or diabetic neuropathy. But don't wait, this needs urgent attention. Sign number 7 is severe or frequent muscle cramps and twitching, known as fasciculations. If you're getting painful spasms or fluttering in your legs, arms, or hands multiple times a day, especially at rest, this could indicate serious motor nerve damage. Unlike cramps from a workout, these persist and often disrupt sleep or work. One patient described nightly calf cramps that left them exhausted. Hydration and gentle stretching can offer temporary relief, but frequent episodes suggest progressing neuropathy. Contact your doctor for blood tests to check for deficiencies like magnesium or nerve studies to rule out rare conditions like ALS. Document the frequency and intensity to guide diagnosis. This isn't just cramps when it's this severe. Sign number 8 is open sores, ulcers, or infections on your feet or hands. If you find wounds that won't heal, redness, swelling, or pus, especially if you didn't feel the injury due to numbness, this is a medical emergency. We've had patients arrive with foot ulcers they didn't know existed, and some needed urgent care to prevent amputation. Neuropathy's loss of sensation lets injuries go unnoticed, inviting infection, particularly in diabetic patients. Check your skin daily. Keep wounds clean and cover them, but don't rely on home care alone. See a doctor or wound care specialist immediately for evaluation and tests like blood work or imaging to address the cause and prevent serious outcomes. Sign number 9 is severe digestive issues disrupting your life. Persistent nausea, vomiting, diarrhea, constipation, or feeling full after small meals can mean autonomic nerves controlling digestion are failing. It's like a traffic jam in your gut, causing discomfort that diet changes don't fix. We've seen patients struggle with eating due to constant bloating or nausea. This can lead to malnutrition or dehydration, especially in diabetic neuropathy. Keep a food and symptom diary and stay hydrated, but these are temporary measures. Contact a doctor for tests like gastric motility studies to confirm nerve involvement and explore treatments. Don't ignore this. It's a sign of serious nerve damage. Finally, sign number 10 is extreme changes in sweating or temperature regulation. If you're sweating profusely in cool weather, have stopped sweating in areas like your feet, or feel constantly cold, your autonomic nerves are likely compromised. Patients have reported soaking their bed with night sweats or cracked, dry feet from no sweating. This is like a broken thermostat, increasing risks like infections or heat stroke. Dress in layers and moisturize dry skin, but see a doctor immediately if this pairs with other symptoms. Tests like sweat function studies can confirm neuropathy and pinpoint causes like diabetes or toxic exposure. There you have it, the 10 signs you need to seek care for neuropathy now, from severe tingling to life-altering autonomic issues. These are your body's urgent cries for help, and acting fast can prevent irreversible damage. If any of these sound familiar, don't wait. Call your healthcare provider or neurologist today for a full evaluation, including nerve tests or blood work to uncover the cause. At Innovative Nerve and Joint Centers, we've helped countless patients manage neuropathy with drug-free, non-invasive approaches, and early action is key. For more health insights, subscribe to our channel and share this video with someone who needs it. If you're experiencing these signs and want a personalized plan to address your neuropathy, contact us to see if we can help. Stay proactive, stay healthy, and we'll see you next time.